Hello, I'd like to welcome you to a very exciting presentation regarding a new non-surgical fat reduction and muscle toning system. The Futura Pro has been available to us now going on 6 months, and we've really seen some very impressive results with this system as we had the opportunity to compare it to the existing systems for non-surgical fat reduction and circumferential reduction. This system is very different than any system that is currently on the market in that it utilizes a dual technology as compared to other systems. It first utilizes a diathermic ultrasound, which acts to weaken and collapse the fat cell walls, thereby breaking down the fat cells, in some cases emulsifying the adipose tissue, with subsequent release of triglycerides, release of fatty acids. Subsequent to the ultrasound treatment, the patient is then connected to a series of electrodes which cause an isometric muscle contraction utilizing transcutaneous electrical energy. The results of the deep muscle stimulation to exhaustion of these muscles creates a scenario whereby the muscle tissue needs to gain energy, and it gains its energy then by consuming the fat that we have and the triglycerides, the fatty acids that we have broken down by the lipolysis evacuation. We also see an increase in circulation as well as some removal of toxins by this process. We embarked upon a study of 10 patients. Each of these patients underwent a treatment spaced 1 week apart with a series of 6 treatments. We then had the ability, after performing this study, of following these patients up over a 3-month interval. So this gives us a beautiful 6-month observation of the patients that we were able to treat. All of the patients that entered into this study we found had a circumferential reduction in the area of treatment. Each patient, without exception, we saw a weight and a BMI reduction. Blood was drawn, as we'll show in subsequent slides, and I think this is what I'm the most excited about with this treatment, is that we saw a significant improvement in health with these patients, with uniformly serum triglycerides, serum cholesterol, serum glucose being reduced in many of these patients. We had a couple of borderline diabetics who have since normalized with their sugars. So this has created an overall improvement in health for these patients, which we have not seen with the competing non-surgical systems. From a longevity of results standpoint, we'll speak to this. I think the patients who have had the highest BMIs entering into this study, we saw the nicest results. These patients were then motivated to maintain a regular exercise program. They were stimulated to improve upon their dietary consumption, and we've really seen longevity of results again that we had not seen with the previous non-surgical fat reduction systems. The study prior to treatment relating to circumferential reductions, patients were measured prior to and after each treatment using predefined and measured areas of their body. Current treatment areas that we have embarked upon include the abdomen, the hips, the buttock, and the thighs, and these are the areas that the majority of patients seeking non-surgical circumferential reduction were certainly the most interested in. The patients were weighed prior to each treatment and their BMIs calculated. From a health benefit standpoint, the lab tests that were performed were serum glucose, a lipid panel consisting of total cholesterol, triglycerides, HDL, and LDL. We measured C-reactive protein as well as homocysteine levels. So each patient had their blood drawn prior to the initiation of treatment, after the ultrasound treatment, and after the muscle biostimulation. The tests then were compared with each treatment. From a health benefits standpoint and a psychological response, the patients really received immediate gratification with this, in that the vast majority of patients noted a significant circumferential reduction upon getting up off of the table. And so this is also a tremendous benefit in the system. The other non-surgical fat reduction systems, there's a delayed gratification in that the patient has to wait to see the results of these treatments. From a blood panel standpoint, we consistently across the board saw serum glucose reduction. It makes sense that we saw the triglycerides go up after the ultrasound treatment with the lipolysis and down after the muscle stimulation when the exercised muscles were seeking their energy and consuming the triglycerides. It also is logical that C-reactive protein also went up after muscle stimulation. So let's look at some patients specifically. One of our first patients that we studied was a 42-year-old female that had an initiation BMI of a little under 29. Her pre-treatment triglycerides were 116. Her post-muscle stimulation triglycerides came down to 97. We noticed a significant reduction in her cholesterol, an increase in her HDL with a reduction in her LDL. Again, we noticed her glucose went down, and in repeating these tests at 3 months, again, we're noticing this consistent pattern. Another example, again, with all of these patients, the pattern is the same, with a reduction in triglycerides from the pre-treatment to the post-muscle stimulation, a significant reduction in cholesterol. Over the field, typically we would see an increase in the good fat, a reduction in the bad fat with a reduction of glucose. Here's an example of the patient in patient 1. You can notice the area of her love handle area as well as her outer thighs. We see a significant loss, particularly in the right leg, where we saw a loss of 7 centimeters subsequent to treatment, 5 centimeters in her left leg. Her abdomen, you can see a loss of 5.5 centimeters, mid-hip 6.5, lower hips 4 centimeters. Again, from the abdomen, we see a significant reduction in the lower abdomen subsequent to her 6th treatment. Each treatment, we see a progressive decrease in the area being treated, which again, from a longevity standpoint, we're seeing this stand the test of time, particularly if the patient is maintaining a good diet, maintaining a level of exercise. Of our failures that we'll talk about, that is really paramount, but I think that would be evident with any of these systems that we're using. If these patients don't change their lifestyle, these patients aren't coming to us for this treatment because they are skinny, because they have great BMIs, because they're exercising a lot and eating well. They're coming in because they're essentially lazy, they do little to no exercise, they're eating horribly. And as part of doing this treatment, it was very important in counseling the patients on what would be a reasonably expected healthy exercise regime, as well as a caloric intake that is generally in keeping with their age, their height, and their weight. So compliance to these treatments was quite high. The patients do have to be able to tolerate. We saw the patients that got the best results were the patients that allowed the highest level of muscle stimulation. And the muscle stimulation is a different feeling for these patients. It's not so much a pain description, but it does. The patients are very aware that they are having sequential, intermittent, and in a series muscle contractions in the area. And so those patients that we saw have the nicest results were those people that were able to tolerate the highest intensity of muscle stimulation. As I mentioned, the maintenance of a diet and exercise program was very important. We also found that it was important that the patient's treatment be performed on an empty stomach. This is one of our most impressive results. You can see that the high abdomen, this patient lost almost 6 inches. Mid-abdomen was 9.5 centimeters, lower abdomen 7 centimeters. We followed this patient up at 3 months, and these results are consistent at 3 months, he has maintained a very rigid level of exercise, watching his caloric intake. These patients are then highly motivated. With his picture on the left, he always had a reason why he was too tired to exercise, too busy to exercise. When we can give them some immediate gratification with a endpoint goal that they can maintain, we found that psychologically that has played a very big role in the maintenance for these patients. So these pictures really speak for themselves. With the competing technologies for non-surgical fat reduction, which we have had the benefit of using all of them, I never saw a single patient that had these kinds of results with this long-lasting type of benefit for the patient as well. So in all views, again, this patient three-dimensionally has a significant circumferential reduction in all areas. So again, at 3 months, we've also been able to follow this patient up, and again, these measurements are within 10% of the measurements we've currently taken for this patient. Patient number 3 was a 60-year-old female who again was able to tolerate excellent muscle stimulation. You can see from an abdominal standpoint, she lost from a low of 1.2 centimeters to the high abdomen of 6.2 centimeters from a circumferential standpoint. You can see she's had some previous liposuction and was unhappy with the unevenness that her surgeon left her with, and this treatment has caused some evening of that area as well. You can see in her love handle area, significant reduction in the overhang of her undergarment, as you can see on her lateral view as well. With this patient as well, we see a significant reduction both in the abdomen, the hips, as well as the thighs. So time and time again in all of these patients, we see a significant reduction in circumference with these patients, loss of size from clothing. This is very highly motivational for these patients to maintain this over time. And at our 3-month follow-up subsequent to these treatments, these patients have all maintained the results that we've given. This patient began with a BMI of 30. That's also something significant to note. The patients with the highest BMIs tend to get the better results. We have a subset of patients now that we're embarking on treatments with lower BMIs, where we're now looking simply at the muscle toning capabilities of these treatments. We're seeing this to have tremendous benefit, especially in the area of tightening up the buttock region for the younger to middle-aged patients who are just starting to see loss of muscle tone. We have a series now of 20 patients that we're treating just to improve the muscle tone of the abdomens. Post-pregnancy patients, this is a tremendous form of therapy to get them back to their pre-pregnant state. This patient, higher BMI, again, you see consistent losses in all areas that were measured for this patient. A significant reduction in her midriff and the area of hanging over of her garment. You can see if we use her tattoo and her undergarments as measurements, that we see a significant reduction again in all areas that were measured. And again, important in all of these patients, I think it's very important at the end of these treatments to keep following these patients up. We offer to be the level of accountability for these patients. So after their 6th treatment, we continue to see them weekly for 1 month, and then 1 month for 6 months as part of what they're paying for, so that we can be a gauge on their overall success. Patient a tremendous result, losing 10 centimeters around the lower abdomen region. You can see just from her size, it was not comfortable for her to exercise. She felt very self-conscious going to gyms. Subsequent to this, it gave her enough self-esteem to embark upon a regular exercise program. We also highly recommend that all of these patients hire personal trainers who give them a second level of accountability subsequent to coming to our offices. See the measurement from her tattoo to begin with, to her anterior abdominal wall, and then after her 4th treatment, she's seeing excellent results. We're then offering to these patients, after our first package pricing for them, to offer them maintenance treatments should they so desire. Many patients do come in after they really tend to enjoy and appreciate the muscle stimulation that they get from this, and we're seeing a high success rate in cross-selling and in upselling then subsequent packages of this. Patients 8, 9, and 10, again, results were not as impressive. These patients did not tolerate even the mid to higher treatment settings. They admitted to increasing their caloric intake beyond their normal consumption during the study, and they missed or were very inconsistent with their treatment. So this is also very important. The patients have to agree to the package as it's set forth for them. They have to be very forthright with us with their exercise and with their caloric intake. But by and large, this has been a tremendous addition to the armamentarium that we now have for the treatment of patients seeking non-surgical fat reduction. And from what I have seen over the past 3 years, this has been, without hesitation or reservation, the most successful form of non-surgical fat reduction that we've seen enter the market.